Anita, can you tell us a little bit about Baker acting and sort of what does that mean? What does that mean for a patient?
Okay. Baker acting basically is when someone is a suicide risk. They can be of harm to themselves or of harm to someone else. You know, someone that has a specific plan, when you ask them, you know, do you want to hurt yourself? They have a plan they're going to carry through. And, you know, it involves, it can be very complicated. It can happen in the primary care office. You know, we get police officers involved.
Correct.
We complete a Baker Act and we transition them to a facility that's a Baker Act accepting facility so that they may receive the care that they need.
Correct. So it's sort of a way to mandate the emergency treatment that has to happen for your mental health.
Yes.
It can be very scary for a patient, correct, Dr. Franco, wouldn't you say?
Yeah.
How do we help patients sort of cope with the fear of being Baker acted, or maybe they don't want to be Baker acted, or maybe they've been Baker acted in the past? Do you have techniques for that?
I think just really stressing the importance of we're doing this for their own help, for their own good, that they may be so severely depressed they don't realize how much of a risk they are to themselves or to others. And while this becomes an involuntary examination by a psychiatrist, patients have to realize that it's for the best. Like we described, is similar to a patient with chest pain.
Correct.
They need to be seen by a cardiologist and have more specific testing to see if that's a true heart attack. We kind of look at suicidal intentions the same way. Is this patient truly going to act on these thoughts of killing themselves? And we need trained professionals to help with that. And oftentimes that involves being in the hospital, having more close watch and supervision and more evaluations. Also have to remember that if a patient is placed under what we call the Baker Act, or this involuntary examination, they may be seen by a psychiatrist at a psychiatric facility and be deemed okay, that they can do okay with just outpatient treatment and not need to be, you know, held in an inpatient psychiatric facility. So just because you are going into this Baker Act process doesn't mean that you're going to be involuntarily, you know, committed to a hospital for a very long time. It just means you're going to undergo a more complete evaluation with a psychiatric professional.